Diabetic neuropathy, it's a serious problem that leads to debilitating pain. So we wanted to address this issue by inviting Dr. Eric Church to Your Life, Arizona this morning. He happens to be the Chief Medical Officer from Arizona Pain. Arizona Pain is not a one-size-fits-all kind of operation, which is exactly why, Dr. Church, I really kind of appreciate your perspective on this whole subject, this whole issue. So thank you this morning for joining us. So let's dive right in. Diabetic neuropathy, what exactly is that?
Well, diabetic neuropathy is a result of diabetes. Diabetes affects many systems in the body, and one of the systems that it affects is the nerves in your feet and hands. Diabetes causes a decrease in the microcirculation, and it starts to damage the nerves. And nerves in your body send signals to your brain all the time. We don't even think about it. But when they're damaged, they send abnormal signals to the brain. Remember the TVs with the rabbit ears? Right.
Yeah, so, you and I are old enough to remember that.
Right. So when we had damaged rabbit ears, we saw static on the TV. So when you have damaged nerves in your feet, your brain is seeing static like the TV.
Got it. You know, it's funny because we often hear how diabetics have circulation issues, and in very extreme situations, you see amputations, you know, of feet and hands. Is this related to that?
Absolutely. If, you know, the symptoms of diabetes, diabetic neuropathy is numbness, tingling, burning, hot and cold sensations, balance issues. So if you can't feel your feet, you get, you step on something, you get a sore, you have poor circulation, that sore doesn't heal, you get an infection, that's what ends up ultimately could result in an amputation.
You know, earlier I was talking about how I like the way your clinic has such a comprehensive approach. You've got chiropractors, doctors, you really kind of look at, you know, each patient as their own individual, you know, case. It's not a one-size-fits-all. But you were saying that there's a procedure in particular that you guys use that's similar to an epidural to treat this kind of neuropathy specifically.
Yeah, so it's called spinal cord stimulation. That sounds kind of scary, and we were talking earlier. It's basically two epidural catheters placed in the spine, like when women have an epidural placed for labor and delivery. So it's relatively safe procedure, and that technology is used to help decrease that static to the brain and help resolve the symptoms of the diabetic neuropathy.
And so reduce the pain ultimately.
Ultimately.
So, you know, before we actually commit to it, because I imagine so many people who are at home right now suffering thinking, yes, I just want some relief. You say, you know what, actually, before we actually buy the car, let's test drive this. Can you help me understand?
Yeah, so I like to use the test drive the car analogy. We actually know from our data that 9 out of 10 patients are going to see a 50% or better improvement in their symptoms. So we want to know which 9 out of 10 patients that's going to be. So what we would do is we do a temporary procedure where you test drive the technology for a week. After a week, we remove everything, and then we ask the patient, did that make your life better? And if it made their life better, then we would offer a more longer-term solution.
I like the fact that it's not a full-time commitment immediately before you actually know what it feels like. But I imagine a lot of people say, yeah, this is working for me, yeah?
Well, yeah, with our data, it's 9 out of 10. That's pretty high. And there's not many things in medicine that give that kind of success rate.
Yeah, I bet. Well, Dr. Church, thanks for the good work that you do. Really appreciate how you help people. And thanks for spending some time with us this morning here on Your Life, Arizona. Well, if you want more information about a diabetic neuropathy or Arizona Pain, you can check out their information online. The website's on your screen along with their phone number.